I would like to bring closer to you what is that we do in the Heart Center at St. Paul's Hospital. Here is our humble building that's over 100 years old, and if you were to look at it just a few blocks away from here, you probably wouldn't think about the number of world-leading initiatives that go on there. What I'd like to show you that beside the numbers that Diane already mentioned, the number of patients, surgeries, angioplasties, transplant, and so on, there are people. And what makes our program unique is those people. They often benefit from the work that you do and the donations that St. Paul's Hospital Foundation bring to date. One of the unique aspects of the Heart Center is that we can put together world-leading clinical care teaching for the University of British Columbia and Simon Fraser University, and the research, which is often unique to the center here. In no particular order, I'd like to introduce to you a few of my colleagues who have led programs, provincial programs, often national or international programs designed to stop the heart disease. One of my colleagues, Dr. Anson Chang, is a cardiovascular surgeon extraordinaire. He happens to be a director of the heart transplant, but also director of the mechanical circulatory devices, which is a big name, but essentially it means artificial heart. And that is the program that's biggest in Western Canada, and in fact the same size as programs in Toronto and Montreal. And you will hear from somebody who has been a beneficiary of this approach. Dr. Chang is also one of the 2 surgeons in the province who are skilled in replacing heart valves, not through the traditional technique of open heart surgery, but he's able to put them into the groin or to the small keyhole in between the ribs. He's has taught many surgical teams across the country and in various continents. He's just recently come back from the trip to Asia, where he has introduced this particular surgical techniques to colleagues in Hong Kong and Singapore and in Australia. This is one of the many firsts. This is I don't know if you can see it well, but this is one of the youngest recipients of such artificial devices, a 14-year-old young man whose heart stopped, who received a miniaturized heart pump that supported the work of his heart for 7 days, allowing the heart time to completely recover. This person would not have survived in the olden days or would have been transplanted with a new heart. Because of that advance, he can enjoy life to the fullest without much in the way of physical abnormality. And the picture there, which I don't know if you can see, in your right heart lower corner is a pump that is called ventricular assist device that's often implanted in people either as a bridge to heart transplantation or a bridge to recovery. And we're the only program in the province that can do that. Another first is Dr. Karen Humphreys. We have long been involved in prevention and treatment of heart disease, and we, as cardiologists, realize that men and women present differently with the heart disease, have different responses to medical and surgical treatment, and have different roles in our society as caregivers or care recipients. And we have been quite interested in studying this problem further. And here, Dr. Karen Humphreys is the first recipient of UBC Heart and Stroke Foundation Professorship in Women's Cardiovascular Health. This is first in the country and could not have happened without support from our St. Paul's Hospital Foundation. Dr. Humphreys, who you may have seen on the news, received this professorship. This is endowed professorship that will allow her to study the idea about women's health for the next 10 years. Received this professorship just a year ago, and you may have seen in the news already one of the biggest trials showing that risk factors for younger women, less than 55, versus men younger than 55 who come down with heart attacks are totally different, and so are their outcomes. I think we're looking forward to more national and international research in that very important arena. I think we owe it to our mothers, our wives, and our daughters that we, as clinicians, provide appropriate care there. Here is another first. My colleague, Dr. Scott Lear, who is a recipient of Pfizer Heart and Stroke Foundation Chair in Cardiovascular Prevention Research at St. Paul's Hospital. This is a $5 million or close to $5 million endowment that will allow Dr. Lear and many like him to study the issue of cardiovascular prevention, essentially in perpetuity. Dr. Lear is also associate professor in Faculty of Health Sciences at Simon Fraser University. We are uniquely positioned that we are able to work together with many institutions of higher learning in Vancouver and elsewhere. His research interests include not only cardiovascular research prevention, but also telemedicine. If you look at the vastness of our province and where the population is located in one corner of it, the biggest challenge is how to deliver care in areas that are remote to us, often thousands of miles or kilometers from where we are, and through the innovative use of virtual environment, telemedicine. Dr. Lear and his team, we hope, is going to be able to show us how to deliver care and prevention to those remote communities. One of his research interests is also in built environment. If you look back of what causes heart disease, why it is that we get heart disease, it's often because the areas where we live, where there is no walkways or there is no green areas. That's one of the most interesting aspects of healthcare, and where the healthcare actually merges with the environment. And I'm looking forward to seeing more of those studies from Dr. Lear. Here is one of my senior colleagues, Dr. John Webb. If anybody knows anything about St. Paul's Hospital in a remote part of our globe, it is because of him. He single-handedly developed a technique called TAVI, which is the replacement of the valve through the groin. This has been tested in people who could not otherwise have open heart surgery because of high risk. And he has pioneered this procedure of over 10 years, and he has now the largest experience of anybody in the world. He has tutored over 200 teams from various areas of the world, and in addition to being able to do it in person, we, together with the Heart and Stroke Foundation, developed a virtual teaching lab where high-definition images, not like those, can be actually transmitted across the world, and the surgeon may have a feeling that he or she is in the operating room with Dr. Webb. Dr. Webb is also a provincial director of that program, and that's run out of St. Paul's Hospital. And largely, as a recognition of his tremendous achievement, we were able to fundraise and deliver MacLeod Family Professorship in Vascular Heart Disease Intervention. Here is a picture of Dr. Webb teaching as cardiologists half the world away about the surgical techniques, which I just mentioned. Dr. Gordon Francis will be talking to you shortly. Gordon is a personal friend. He is a professor of endocrinology and metabolism, and he is a director of the Healthy Heart Program Prevention Clinic, and he's my partner. This is the only prevention clinic in the province. It can look at all aspects of prevention, including treatment of genetic disorders of lipid metabolism. In fact, Gordon is working now on a database, provincial database, that will allow us to provide treatment-altering research for this condition. Gordon is also a researcher extraordinaire and recipient of several grants. His research is conducted in the Heart and Stroke Foundation Lipid Research Laboratory at UBC James Hogg Research Center at St. Paul's Hospital. And he's very interested in HDL cholesterol, that's the good cholesterol, how to raise it, how to work it, how to treat low levels of HDL cholesterol. He will be speaking with you shortly, and here he is pictured with a team of other researchers in this laboratory. Lastly, I'd like to introduce to you Dr. Jasmine Grewal. She is a staff cardiologist at St. Paul's Hospital, and we were quite fortunate to recruit her in support of another unique provincial program in our hospital, and that is Pacific Adult Congenital Heart Clinic. Jasmine also works in a high-risk cardiac pregnancy clinic, again, the only clinic of such sort in the province. Jasmine has been trained at UBC and then McMaster, and received further training in Mayo Clinic. And we've been quite happy to be able to recruit her, and largely, again, through the St. Paul's Hospital Foundation efforts, we were able to support her research through the scholarship that she was awarded for the subsequent 3 years. And this is some of the pictures of patients whom Jasmine has helped tremendously in her capacity. To learn more about services at the Provincial Heart Center, www.heartcenter.ca, and to work with St. Paul's Hospital Foundation supporting our world-leading patient care research and teaching, www.healthstpauls.com. I could only show you 5 short vignettes of some of the colleagues with whom I work. Please understand that there are many others. We're not here about showing you the stars, we just show you some of the aspects of care that we provide to the patients in British Columbia. If we ever do a forum like that again, I will be able to show you several more province and national leading programs that are now offered at our hospital.